The American Heart Association has really been instrumental in my career trajectory. As an epidemiologist, my research group is really focused at looking at preventing the onset of coronary heart disease. So if we put together food dietary patterns and exercise patterns and factors related to weight training and smoking cessation, if you put all those factors together, we can explain about 80% of coronary heart disease in this country among women, and somewhere in the range of 65 to 70% of coronary heart disease among men. That's pretty powerful.
Dr. Eric Rim is an epidemiologist and past American Heart Association awardee at the Harvard School of Public Health. He and his team are looking into how nutrition, physical activity, and other lifestyle choices can have a significant impact on a person's risk for coronary heart disease.
Earlier on in my career, I also got an Established Investigator Award, which was, again, I think a unique opportunity for me to try something novel, and it really was an important part of my career and my career growth to have that funding.
Dr. Rim is a mentor to Dr. Stephanie Cuvey. Dr. Cuvey is the recipient of an American Heart Association clinical research grant.
Some of the work that I plan to do using my clinical research program award from the American Heart Association is to take these lifestyle habits and to develop a cardiovascular risk prediction model based on diet and lifestyle habits. And this follows up with the American Heart Association's 2020 impact goals. One of them is to try to improve the cardiovascular health of all Americans by 20%.
Since 1949, the American Heart Association has invested over $3.2 billion in research. The American Heart Association funds basic, clinical, and population research, including translational projects.
And I think it's really great because I was able to develop my own grant, and that was really based on all of my own research. And so I do have a level of independence, but that I also have a mentor that's going to be able to help me see this grant to completion. So I think that the American Heart Association has done a great job really trying to help young investigators and to come up with mechanisms to help them, both in terms of funding as well as career development. For example, there are a lot of Young Investigator Awards, which I would encourage any young investigator to apply for.
The AHA offers predoctoral and postdoctoral fellowships, a number of career development awards, and research project grants. There are currently 2,500 AHA-funded scientists across the United States.
There is something unique for everybody within the AHA, and for me it really has been across the board, from a student trainee to a faculty member and now to a senior faculty member, just as a way to bring together the field and to understand the etiology of heart disease.
To learn more about American Heart Association funding opportunities and to apply online, visit research.americanheart.org.